Hello and welcome to today's lecture. I'm Ibulani and I'll get you through today's topic. In this video, we will discuss about nursing management for COPD or chronic obstructive pulmonary disease patient. I hope you have read your textbooks before watching this video. We will review and improve your comprehension of the subject, and this lecture is intended to provide you with clear, practical ideas that you can apply. We'll go over the major concepts step by step using examples and explanation to make things as clear as possible. So, take your notes, relax in, and let us get started. Okay, before we begin, let us quickly review our learning objectives for this session. These objectives will help you to understand what you should learn and take away from the lecture. By the end of the session, you should be able to understand the pathophysiology and medical management of COPD, and hopefully you are able to formulate an appropriate and systematic nursing assessment, diagnosis, intervention, and implementation, also evaluation for patients with COPD. Okay, next. Breathing is something we often take for granted until it becomes a struggle. Chronic obstructive pulmonary disease, or COPD, is a progressive lung condition that affects millions worldwide. It develops slowly, but its impact is life changing. Before we explore the nursing management on COPD, we need to aware on critical points of this disease. It is really important to understand how this disease works and why early awareness matters. The first critical point is COPD is characterized by chronic inflammations of the airways, lung parenchyma, including bronchioles and alveoli, and also the pulmonary blood vessels. So it impacts in every part of the patient's lung. The defining feature of COPD is the airflow limitations. It's not fully reversible during forced exhalations. It is caused primarily by loss of elastic recoil and airflow obstruction. And also there are mucus hypersecretion, mucosal edema, and also bronchospasm. So it's kind of complicated for everything that happens in patient's lung. It should be more flexible but in the case of COPD, there are atelectasis that worsen the condition of their lungs. The next point is the inability to expire air is the main characteristic of COPD. The main site of the airflow limitation is in the smaller airways. So, as you can imagine, the peripheral airways become more obstructed. Air is progressively trapped during the inspiration phase. The primary complication that can occur in patients with COPD, including pulmonary hypertension, core pulmonal, acute exacerbation, and also ARDS or acute respiratory failure, which is really life-threatening for the patients with COPD. Okay, the next one, we're going to look about the pathophysiology that I believe that you already watched the video before. COPD, like I said before, is characterized by persistent respiratory symptoms and also airflow limitation that is not fully reversible. As described on the picture, the pathophysiology of COPD involves chronic inflammation affecting the central airways, peripheral bronchioles and alveoli, and also the pulmonary vascular changes. This inflammation leads to structural state change, including narrowing of small airways, destruction of alveolar walls, and loss of lung elastic recoil, primarily due to the imbalance of proteases and also antiproteases. Additionally, mucus hypersecretion, mucosal edema, and also bronchial smooth muscle contraction contribute to airflow obstruction. The air becomes trapped during expiration, resulting in lung hyperinflation and an increased residual volume. Over time, this can cause significant impairment in gas exchange, leading to hypoxemia, hypercapnia, and ultimately ventilatory failure. Chronic hypoxia can also result in pulmonary hypertension and core pulmonal, which is the late complication of the disease. Next, we are going to look at the interprofessional care for chronic obstructive pulmonary disease or COPD. The effective management of COPD requires a coordinated interprofessional care approach. The goal of the care includes relieving symptoms, improving exercise tolerance, preventing complication, and also enhancing overall quality of life of the patients. The interprofessional team includes physician or doctors, nurses, respiratory therapists, pharmacists, dietitians, and also family or social workers, each of it playing a vital role. Here are the diagnostic assessment that the doctors usually do for patients with COPD. It's really important for us as nurses to understand because we work closely with doctors. At first, maybe he will take history and physical examination, some spirometric tests, chest X-ray, serum antitrypsin levels, ABGs, 6-minute walk test, and also COPD assessment tests. It is really important to understand every diagnostic test because it will impact the objective data of nursing management. For the management, of interprofessional care for COPD, it's still important to for the cessation of cigarette smoking and for the physician to manage the drug therapies and for the respiratory therapist to ensure the patient know how to learn about the technique to clear the airway, breathing exercise, and also retraining. And for dietitians and nurses, make sure they have nutritional supplementation and also adequate hydration for 2 to 3 liters per day. It is also important for patients to take immunizations like influenza and also pneumococcal vaccines. We need to collaborate on long-term oxygen's use if it is indicated, and also making progressive plan for patients' exercise, especially walking and upper body strengthening. And also, we need to be aware about the treatment of the complications and also the surgical therapy that may need it based on every patient's condition. Okay, so now we are going to look more deeper about the nursing management for the patients with COPD. The first one is, of course, nursing assessment. We need to gain data, the subjective and objective data. For the subjective data, we need to explore about the important health informations like past health history and also medication. You need to ask the patient whether the patient have long-term exposure to chemical pollutants, respiratory irritants, and also other infection and previous hospital hospitalization, and also whether the patient use medication or oxygens like and also bronchodilators, corticosteroids, antibiotics, and so on. It is really important so you know um, what the status of the patient's health. Also, we need to dig deeper about the functional health patterns of the patient. It is important to know the health perception and health management of the patient, whether the patient have the habit of smoking and also how many packs and also how long, including passive smokings, if there is willingness to stop smoking, and also previous attempts. And also, you need to know more about family history of respiratory disease. Maybe have some asthmatic status or others diseases. Also, for the nutritional metabolic, look if the patient have anorexia or weight loss or gain. Need to explore more about activity and also increase exercise, elimination, the sleep rest pattern, cognitive perceptual, and also coping stress tolerance. All of these subjective data will really help the nurse to understand the patient's conditions and make better nursing diagnosis. The next one, of course, we need to gather the objective data. We will do head to toe assessment and focus assessment on respiratory system. For the general, you can see if the patient have restlessness, and also assumption of upright position. For the integumentary system, look for the cyanosis, the pallor of radicolor, poor skin turgor, thin skin, digital clubbing, easily bruising, peripheral edema, and also others sign and symptoms. For the focused respiratory assessment, you will see the respiratory, whether it is rapid or shallow breathing, inability to speak, prolonged expiratory phase, sleep breathing, whether there is increasing freckles on auscultation, and also decrease or absence of breath sound. For the cardiovascular, look for tachycardia, dysrhythmia, jugular venous distension, and also edema. For gastrointestinal, you can look for ascites, hepatomegaly as the sign of core pulmonal or the complication. For the musculoskeletal, look for muscle atrophy and also maybe barrel chest. And also the last one, you can gain objective data through the possible diagnostic findings um, from the laboratory checking. You may see abnormal ABGs with compensated respiratory acidosis, polycythemia, pulmonary functional tests that showing expiratory airflow obstruction, such as low FEV, low FEV1, and large RV, and also, of course, the chest X-ray that may show flattened diaphragm and hyperinflation or infiltrates. Based on all the data, you can make the nursing diagnosis. There are several nursing diagnoses that make possible for patients with COPD, but let me um, give you one example. The first one is the impaired gas exchange. It may relate it to alveolar-capillary membrane changes as evidenced by low O2 saturation, dyspnea, and ABG changes. The second one, ineffective airway clearance related to increased mucus production, weak cough, or ineffective cough method as evidenced by productive cough, adventitious breath sounds, and the third one is activity intolerance related to imbalance between oxygen supply and demand, as evidenced by deep snow on exertion and also fatigues. There are more diagnoses related on nursing with patient with COPD that you can see in here, and just match it with the data that you gain from your assessment. Okay, for the next one is the nursing outcomes. These are all the goals that the nurses want the patient have after they give the implementations. The first one is we are expect the patient have relief from symptoms, have ability to perform ADLs and improve exercise tolerance. There are no complications related to COPD, have knowledge and ability to implement a long-term treatment plan, prevention of disease progression, and the last one, overall improve quality of life. Here are nursing implementations. Like I said before, we have three main divide implementation. First one is health education, acute care, and also ambulatory care. For the health education, there are a lot of topics that you can take for the patient, that you can teach to the patient, and why it is important. Let me um explain to you one topic that's really matter for the patient, which is the first one about the smoking cessation. What to teach, that we need to teach the patient to stop smoking immediately, and also offer some programs and medication option to support their decisions. Why is really important for patient with COPD? Because quit smoking is really slow the disease progression. It didn't stop the progression, but it is really help to slow before the patient get into the worst condition. There are a lot of topic. You can choose one that related to your patients, such as maybe the medication, oxygen therapy, breathing techniques, and also emotional support for the patients. And next, this is are the these are the nursing implementation on acute care. So there are several things that you need to look at when you have patients in hospital. The first priority, of course, is the airway management. You need to make sure that the patient have good have good airway management by position patient upright or high fowler, encourage the patient to do pursed lip breathing, and also teach half coughing. It's really important to improve lungs expansion and help clear secretions. And also we can collaborate to administer oxygen therapy, give the patient low flow oxygen 1 to 2 liters per minute, and be careful not to give them a lot of high concentration oxygen, because it can cause problems with patient with COPD. You need to monitor SpO2 and also ABGs, and of course use humidification in the therapy of oxygen. It's really important to prevent hypoxemia while avoiding CO2 retention. Also, there are medication administration such as bronchodilators and also antibiotics. You need to monitor the side effects that the patient may have. And also, it's really important to encourage patient to increase their oral fluids, if not contraindicated, administer IV fluids as needed, because it will help to cleanse the mucus and improve clearance of the secretion. Do the continuous monitoring and assessment for your patient. Help them with their anxiety and deep snow control. And also the last one, you need to do patient education in hospital, such as the breathing techniques, the cause, the risk, and also discuss discharge planning earlier with the patient and the family, because it promotes readiness for discharge and prevents readmissions. There are the implementation that you can do for the patient that hospitalized with COPD. The next one is the ambulatory care for the patients on outpatient department or on community. There are a lot of things that also you can do. Um, there are a lot of area of care like smoking cessation, medication adherence, pulmonary rehabilitations, teaching about oxygen therapy, about the activity and energy conservation, nutrition management, and also recognizing exacerbations. Teach the patients the early warning signs of exacerbation is really important to life saving. Um, Inform or follow up the vaccination, give them psychosocial support with family, and also follow up their appointments. You can see a lot of implementation and you can choose what is the right implementation based on your patient's conditions. The last thing is nursing evaluation. After all the implementation you give, there are evaluation that you need to do based on the nursing outcomes. The first thing is you need to make sure that their SpO2 is more than 90%, respiratory rate within normal limits, clear breath sound or improve effective cough and reduce sputum. They use correct inhaler, recognize early signs of exacerbation, tolerate activity daily livings with minimal dyspnea, stable or increased weight, reports reduce anxiety, smoking reduce or maybe stop, attends follow-ups, vaccination up to date, fewer hospital admission, and improve confidence in self-care. That's all the things that you can do for your patients, and hopefully through all this nursing management, the patient will have more quality in their lives with COPD. That's the end of our lecture. We've reviewed the important features of nursing management for COPD, and I hope it helped you grasp the topic better. Please read over our discussion, review your textbooks, and go back to this video as needed. Thank you for watching. See you in the next video.